Hello, good afternoon, ladies and gentlemen. My name is Leisha Richardson, SVP of Marketing for Citus Health. I will be your host for today's webinar. On behalf of Citus Health, we'd like to thank you for joining us for today's webinar, Strategies for Improving Persistence and Adherence Rates. Before we get started, I just want to go over a few housekeeping items with you. If you are experiencing any technical difficulties, please send a chat to me, the host. If you have questions, please type them in the chat window. During the course of the webinar, we will address as many of these questions as we can throughout the course of the webinar, but also take questions at the end and/or respond to any that we weren't able to get to during the course of the webinar as well. And now I would like to introduce our speakers for today, Brandon Carpenter and Melissa Leslie. Brandon Carpenter is President and CEO of MedEdge Solutions, and he has helped hundreds of organizations become some of the fastest growing companies in their space and maximize their profits, including more than 350 pharmacies. He is former director of Rock Pond Solutions, and his work has spanned specialty accreditation, developing custom technology solutions, and product management. As president and CEO of MedEdge, he works with pharmacies in specialty, home infusion, DME, and retail to help them maximize their technology ROI. Joining us also today is Melissa Leslie. She is a consultant with MedEdge Solutions. Melissa has over 7 years of experience working in healthcare software, insurance, and tech industries, providing high levels of support and training to customers throughout their implementation processes. Melissa has worked with hundreds of pharmacies in specialty, home infusion, and DME throughout her implementation processes for various software platforms. At this time, I'd like to turn it over to Brandon. Brandon?
Thank you, Leisha, and thank you everybody for joining us today. Like Leisha said, we're really excited to present today on the Citus Health platform and how we see this platform really helping the specialty pharmacy industry as a whole to help them increase their patient engagement and the outcomes that can provide, such as increased adherence and persistence. So what we're going to cover today is just one of the things is overcoming the onboarding process and the struggles that we have as pharmacies to get to not just getting a referral, but getting to that first fill, because that first fill is so important, not only for the actual process of onboarding a patient and keeping and retaining a patient, but simply for the patient's sake of getting them therapy as quickly as possible so that their disease does not continue to decrease their quality of life. The next thing we're going to talk about is how do we overcome the communication gap? And quite simply, how many times have we heard about Dr. Google and how much information Dr. Google tends to have, but how much incorrect information patients can find. So how do we overcome that so that patients are not confused or misinformed? Then that leads to being an engaged patient who becomes a adherent patient who not only becomes strictly adherent, but exceeds adherence levels that are set so we can kind of raise the bar. And, from a perspective of ROI, how does that also help us as a pharmacy? So when we're getting a patient onboarded, getting that referral in, whether it's for a basic open network drug or for a limited distribution drug, we know the pitfalls of getting a new referral and all the paperwork that needs to happen. There's physician information that has to get captured and pulled back in, and hopefully that's a clean referral. Sometimes we have to send it back to get more information from the physician. Sometimes we get, the payer information and things through that process as well, but a lot of times that's from the patient. So, getting the insurance card information, the AOBs, any copay assistance. I mean, you guys know what those processes look like and the headaches that those can cause just trying to get paperwork moved back and forth. And just to kind of put it into perspective of how many different ways all of this data can just transpire and come about. And at the center of it is your pharmacy and your patient, because you're in business to take care of these patients. So how can we clearly get better information quicker, turned around, so that we can get to a much cleaner and much quicker first fill time? In my experience, I've seen a lot of folks who have come in and said, if we can just get an average of, somewhere between 30 and 45 days for some of these folks, that would be fantastic. And a lot of times we know that the biggest portion of that process is just simply trying to get a PA for a patient. And we're not going to be able to speed up payers as quickly as possible. But if what we can do is get all of our ducks in a row much quicker and get that information off, that at least starts the time clock much sooner, and can get you down into, hopefully, a 3-week period of getting to your first fill on some of those more difficult disease states. But also, it gives you a chance to communicate with the patient, to let them know what's going on. So if you're talking with Brandon Carpenter and he has MS and you're trying to get it on a drug, and, we've had PAs and we had to send it to the physician, we can let them know, we've sent, you require a prior auth, we've sent additional information to your physician to get back to send off to your payer. Or, there's been a miscommunication, or some information came back as invalid. Maybe somebody transposed the numbers for the policy number or group number for the patient. Can you send us a copy of your card? This app will allow you to do those types of things. So rather than trying to engage patients on your time, we're going to show you how this platform will allow you to engage patients on their time and their terms. So the big thing that I have seen time and time again is the communications game being lost by pharmacies. And what I mean by that is, yes, we have information in abundance to patients, but not in the most user-friendly of manners. We send out these welcome kits and they get, hard copies of manufacturer leaflets or additional programs that we offer, things like that. And that's great. And we're doing the best we can, but a lot of times what happens when those deliveries come in, they get their medicine out, they look at stuff, they go, it's okay, and then they throw it out, and then they go to the web and look up some stuff and social media and find groups of people who are taking, this medication or that medication and have had horrible side effects and things, and they go, oh gosh, I don't want to take this because of all this stuff. And if they had something that was more readily available in a centralized location that was specific to them, they might not go out to the internet or the social media and look for those things. So one of the things that the Citus platform will allow you to do is tag. First, you can upload documentation, and right now it's PDF type of documents, but soon to come video links and other types of material. But what you'll be able to do is tag this information based on what it's relevant to, and then tag your patient, and a dynamic educational library will be created for each patient. And so imagine if you are an IVIG pharmacy with an IVIG patient, and you're trying to do the IVIG shuffle, as they call it these days, with the shortages. Well, now you have a patient who's on Gammugard or Hytuvia, and you have to switch them over to Gamunex or something like that. Well, the pure act of switching them over will dynamically create a new educational material library for them. And so now their leaflets for, their old material is no longer available, and now they have their new material available. Or let's say the manufacturer has a YouTube video explaining how to take the drugs and things like that, and they update it. All you have to do is update your link if they have a new link, and now they suddenly have the information readily available to them. So, gone are the days of trying to determine what new material do we have, which patients does it have to go out to, who's received it already, or who's changing drugs and do we need to send it. I have seen fulfillment departments that have 1, 2, even 3 folks who are just sitting back there trying to figure it all out and go, here's my delivery packets for the day. Now they don't have to worry about that. They just have to worry about making sure the right drugs are in there, and things like that, as well as, in cystic fibrosis. I know they talk a lot about, summer programs because it's such a young population and they tend to get off their medications and things. And so, as a cystic fibrosis patient, you can get information sent to you, broadcasted via the health platform, Citus Health platform, or put into your education material for that particular time period. And so you can easily get that information out and no longer have to send out mailings, which is the extra cost of postage and handling and things like that. You can easily get the information to the right people almost instantaneously and keep that updated without a whole lot of manual effort. So the next thing we're going to talk about is patient engagement overall and how that can help us with patients to keep them adherent. And after we're done with this, we're going to switch over to Melissa Leslie, who's going to do us a live demo of some of these principles that we talked about today. So an engaged patient, when you got customized care, what are we talking about? We're talking about, all those clinical questions you have to ask versus, for a MS versus a cancer patient or Hep C, so on and so forth. A lot of times it's very broad and the information is there, but what we're talking about is how do you customize it to a point where they know that Brandon Carpenter is a male, so we don't have to ask the question of, could you be pregnant? We know Brandon Carpenter is a male. Or, what is your pain level, 1 to 10, and somebody puts in a 12? It's not going to accept that. So there's the data validation. But then there's also the piece of, being specific to the patient from a needs. A lot of folks still manage their disease and have to go to work every day. And so when they're having to deal with trying to answer the phone calls from pharmacies between 8 and 5, they may be in a meeting and then they do the phone tag. Well, now what you're able to do is send those questions to the patient. They can answer it while they're on the train going home for the evening or sitting at the ball game, Johnny's ball game, answering those questions. Whatever the case may be, it's specific to their needs and how they need you to communicate with them. And then you get that information back and you can review and you can chat back with them if you have any questions. And everybody can find a minute to text, but it allows them to, what used to be, a lot of times 10, 20, 30-minute phone calls for clinical information and stuff, to get down to, being done 24 hours a day without a clinical pharmacist on the phone with a patient. So when you think about an adherent patient, so many times people think, okay, that's fine. It's whether or not they make good, they take their drugs as directed. What we're talking about is beyond that. Yes, we want our patients to be adherent on drugs. A lot of times people consider the 80 or 85% adherent to be a good patient. And that's fine, and we can continue to keep that moving forward. But what does that mean from a perspective of top line revenue to our pharmacy. Well, if you take an example of a 80% adherent patient on a 20-day fill, you're talking about 13 fills per year there. At a $10,000 per fill, you can see there that you're talking about $26,000 in lost revenue per patient at 80%. Now, again, 80% is kind of the threshold of what we consider an adherent patient. So you might have patients who are hard to get a hold of, but not only that, they're 50, 60, maybe 70% adherent. And so you can see how a 50% adherent patient, now you're talking about $65,000 in lost revenue. And if we could get them to 80%, that's a huge increase for really taking less time with them, but engaging them at the right point of contact. And so if you can connect with that patient through an app that allows them to answer and engage you on their terms and be able to move the needle from 50% to 80% or 90% or higher, you've just doubled your revenue for that single patient with less engagement from, direct engagement from a clinical pharmacist trying to call them constantly, trying to get in touch with them through their physician and things like that. So, just think about what, your adherent patient population looks like, what your troubled patients are, and why they're hard to get a hold of or why they're, not adherent. So with that, Melissa, I'm going to turn it over to you to go through a few minutes of live demo.
All right. All right, can you see my screen, Brandon?
I can.
All right. Well, like Brandon said, I'm Melissa, and now we get to the fun part where we get to take a look at the app itself, the platform, so we can see how to put into play all the principles we've already discussed. So on my screen, on the left-hand side, you'll see the staff-facing view of the Citus Health platform, and on the right, you'll see my device here. I have it mirrored on my iPad so that you can kind of see both sides of the spectrum here. So we'll take a look at the practical application of the platform itself through the lens of what we've already discussed. We know that our end goal is to get our patients to their first fill as quickly as possible. And we know that the hurdles for that are intake. Intake is a long process that involves a lot of data collection. So with the platform, we can really easily see that we can get the data we need in the format we need. It can be smart enough to know, like Brandon said, what we need as far as if it's a numeric value, if it is, we're not asking male patients if they're pregnant, things like that. The forms can accommodate that so that we're not wasting anybody's time. So you can take a look here. This is just a sample form. If I want to send this form to a patient, I can really quickly come into this form center. I can select my patient. I can add a message if I need to. It's going to make sure I'm sending it where I want to. And then really quickly, you'll see on the other side here that I received a form. So I can come out here to my forms and I can fill that out right on my device. So a really, really important thing to note is that I'm busy. I work a job. I may not want to jump on and do this right this second, but if I have a few minutes between calls or if I'm taking a break in the break room, when it's on my device like this, I can do it on my time. If I'm at a ball game, if I'm waiting in line for parent-teacher conferences, whatever it is that I have going on in my day-to-day, this doesn't disrupt it. So the forms again are very user-friendly from the staff-facing point. They can be staff-facing or patient-facing. If they are patient-facing, some of it can be pre-populated so that we're not asking the patient for information we already have. It can be staff-facing. So if we're on the phone, we might fill that out so that for our patients that don't opt in, The staff can fill that out so that all of the data is still collected in the same manner. The forms, again, are very flexible. They're very intuitive, and you can fully customize them to your need, your space, your business. The other thing that's really handy here is, or one of the things that kind of holds up intake, is that sometimes we need signatures. So we can really quickly send a signature request. So I'll do that really quick. It's going to show me that preview, make sure that I'm sending what I expect. And then again, just instantaneously it pops up on my device so that I can handle it when and where I want. Another really handy piece that we talked through is that engagement for adherence purposes. We want to make sure that we are the voice of truth when it comes to what we are giving our patients, whether that means the medication itself, the educational materials, whatever it is that we are giving them, we want to be where they go first. So in the age of Dr. Google, I myself am very guilty of this. So the first thing I do is go to my Safari, I open it up, and I Google whatever question it is that I have. Being in this industry, I know that that's not the best way, but I do it because it's convenient. It's easy. So if we have our educational materials here in our application, it's every bit as easy as going to Google. So I'm going to quickly show you that if you can upload it, if you can get it into a PDF format right now, and you can upload it, you can get it to your patients, have it in their hands quicker than Google. That being said, other formats are coming. So right now we're limited to PDF, but again, that's not going to be the case for very long. So I'm just going to quickly grab this document here. I thought it would put it in there. I apologize. If you go in and you hit browse, I don't want to open up my window for everybody to see, but if you hit the choose files, it'll pull up your file folder and show you. I will show you though on my iPad what it looks like. So you can see I've actually already done this, but I uploaded it so that I can now see this education material right here. So it's every bit as handy and even less time consuming to look at the information right here, because I don't have to go type the question. I don't have to think about what question to ask. I don't have to rely on autofill to know what I'm asking. Everything I need due to my disease state, the medication that I am on, is right here in one spot. The last piece that I want to show you through that lens of getting to our good adherence rates is going to be the communication piece. So I'm going to come out here to the messaging. I'm going to find my patient, and I'm going to let them know that I ran into a snag with the prior authorization and that I need something from them. So I'll initiate the chat here. And I'm just going to let the patient know that I need a copy of their insurance card. I could go into a lot more detail, but I'm not going to do that. For now, I'm going to go ahead and open up my message here. And it says I need a copy of your insurance card. So I can really quickly come out here, snap a picture of it, use that photo, and there I go. No questions asked. If I don't have to go type it in, I don't have to use my thumbs to get it. I can quickly take a picture, snap it, send it, and they can handle the rest. I can do that in a matter of seconds. I can do that on my break. I can do that on my time. Convenience is absolutely key. Some other great benefits to the messaging feature is that, you know, who's on your care team. It's whoever you need to be on the care team. So we have these individual messages. They can be initiated from the pharmacy. They can even be initiated by the patient. If I wanted to start a new chat, I can Click that here. I can create whatever the question is that I have that I need to speak to somebody about. It will send it directly to the queue. The routing system that you set up on your end will tell it where to go. And then I'll get an answer from the person I need to speak to if I initiate it as a patient. Other handy tools is, like I said before, whoever's a part of the care team is whoever needs to be. If I'm having this conversation, we can invite other attendees into the conversation. If I'm a tech and I'm working with a patient and I really need the pharmacy, we can then include them in that conversation. If we need to get a nurse from the clinical or from the clinic, we can get that nurse involved. This offers that kind of flexibility where we can really pull in who we need to. And then once we've had our conversation, that's data that we've collected. We can tag that, put it in a progress note, and it's kept forever for reference. The last thing that I want to show you on messaging is this broadcast message. It's really, really handy. We can send a message to whoever we need to send it to. We can send it out to whatever group of patients that we want. So we've already mentioned that we're tagging patients so that they have the information that they need readily available to them. I can type whatever I want here, and it's going to send it to this entire population. Again, it's going to validate that I wanted to send that message. I sent the message, and you'll see on my device that that popped up for me. So again,
hey, Melissa,
education.
quick question.
Yeah.
We got a couple of quick questions about chat. First one is this customer or this pharmacy has quite a few patients who are English as a second language, and was curious about they have bilingual folks on staff. Does this do any language translation?
Yeah, I'm glad you asked that. I meant to mention that. So any of you that work with the call center, you know that it's kind of cumbersome to use a translation service. You have to put the patient on hold. You have to call the translation service. You have to speak to them, and then they translate it to the patient. The patient speaks back. They translate it to you, and it's a whole process. Using the tool, the messaging tool here inside the platform removes all of that cumbersome process. It can translate right in the application for you. It uses Google Translate, so all of the languages that are available on Google Translate are available at your fingertips, whatever language you speak. So you would type, if I'm the English speaking pharmacist and I am speaking to someone whose Spanish native language, whose native language is Spanish, I can type to them in English. The application will translate it to Spanish. They can reply in Spanish, and it will translate it to English for me.
Perfect, great. And then one other question about the chat is, can patients start their own chat with us, or do we have to initiate the chat? So yeah, basically, if I guess they're having an issue or whatever, they can message the pharmacy directly from the app.
Yes, they can. You hit this start new chat, and it will allow you to initiate whatever the settings are that the pharmacy has in place. So if it's after hours, it might be auto reply that says, we'll get back to you in the morning, or it may go to an after hours queue. But throughout the day, you'll have people that are monitoring the various queues based on the message you get. Based on the message that is sent in, it will route it to that queue to be answered by whoever needs to answer it.
Great, thanks.
Yeah, absolutely. All right, some other key pieces to the messaging is that, first of all, it's very flexible. Like we mentioned, you can send mass messages to everybody. You can send individual messages, and the messages can be very custom to the needs. So if it's taking longer than expected to get to the fill because of a prior authorization, you can initiate that message. If you were just wanting to check in before sending a refill to make sure that the patient didn't have any adverse side effects, you can just send a message for that. It's fully up to the people who are using the platform, how they want to use it and to what extent they want to take it. All right, that's everything that I had to show you, Brandon. I'm going to go ahead and kick it back to you unless there's any further questions.
We did have another quick question about the forms and the broadcast messaging. So on the forms, question is, do you have any pre-made forms? And if not, can you share kind of the lift to create forms? So
yeah, let me come over here and show you this. I'm going to go ahead and maximize this so you can see it better. And I'll come over here to the forms. So there are some pre-made forms that are a little more generic in nature. Throughout the onboarding process of getting into the Citus application, there will be an assessment of the needed forms. We might start with one of these that are out here and then make additional customization to them to fit your specific need. But if you want to come in here and create your own, they're very user friendly. It's this fun, they're kind of fun too, fun drag and drop feature. You have all of these options here. So you would start by naming it. And then you can start adding your fields. So you could start with a single line text. You might tell it, who did I speak to? So if this were staff facing, it would be, who did I speak to? And then you might do purpose of the call. You could do a multiple choice. With the multiple choice, you can have these radial buttons. You can do drop downs. You can do check boxes. It runs the full gamut. You can do dates, so it will format your dates. If you need to collect your dates in a specific format, like month, day, year, or year, month, day, you can set that in there so that you can prompt the patient to fill it out the way you need it. Again, the key is get the kind of information that you need in the format that you need it so that it's as streamlined as possible.
Great. And then one other thing they have is they're doing REMS counseling, and it's a bunch of forms that a bunch of questions they can see as a form. The problem is the manufacturer requires them to have a hard copy. Excuse me. So when a patient answers this, can this go into a PDF type format that shows the questions and the answers provided?
Yeah, absolutely. You can get pretty much anything that you're collecting in the Citus platform can then be moved to the database in the form of a progress note. So if you were to collect this information, you can then get it back into progress notes so that you're collecting that data in the application.
Perfect. All right. Is there any other questions? Lisa, did you have any come up on your side?
Brandon, I don't see any questions right now. We'll give everybody just a minute to ask a question. If you have one, please submit it in the chat window. Brandon, I'll turn the presentation back over to you.
All right. All right, everyone. So that concludes our presentation. Again, we feel at MedEdge that Citus Health Platform is a tremendous opportunity for those in the specialty world to better engage their patients on a much more scalable level to help them in a variety of manners that solve problems that you guys have. And so if there's anything that the folks at MedEdge, Melissa or myself, can help you with, our contact information is on the screen there. We'd love to hear from you. We'd love to help you out if you need some assistance just getting onboarded on the Citus platform or helping you make the decisions on how to get your Citus platform set up. And if there's no other questions, we'll give you back a few minutes of your time, and we appreciate everybody's time today.
Thank you, Brandon. Thank you, Brandon and Melissa, for sharing your insights on how to improve persistence and adherence rates with the Citus Health platform. We really appreciate you taking time today, and I want to thank our audience for participating in the webinar. We will make a recording of this webinar available shortly, so look for a follow-up email within the next day with a recording that you can share with your colleagues. Thank you, everyone. Have a wonderful day.